Hello everybody, welcome to my YouTube channel, NurseEd Simplified. My purpose is to give you a very simplified way of calculations for be it drugs, be it dopamine, be it anything that you seem to be very complicated. So let's move on. Today's topic is dopamine drip calculations. Before we move on, let's know what is dopamine actually, why do we give it, and what is the benefit of giving it. Let's have a quick thing in a nutshell. It is basically a beta adrenergic agonist. What do you mean by a beta adrenergic agonist? Is that its work is that of a vasopressor. What is a vasopressor? It is something called a its work is to press, that is to constrict. It is a vasoconstrictor with positive inotropic effect. What do you mean by a positive inotropic effect? It means that it increases your heart contractility. So in return, it is increasing your systemic vascular resistance. It is increasing your BP, increasing your cardiac output. Simple. Now, how do you give a dopamine? We always prefer to give it IV. Central line is the best option. Why do we say central line? Because it is a potent vasoconstrictor. What are we scared of is that if it accidentally leaks into the surrounding tissues, it causes massive extravasation, leading to potential tissue damage and even necrosis. So we always prefer to give it via our central line. And you will see in ICUs, they are given via central line. The order will be 2 to 20 microgram per minute, per kg per minute. So the doctor will be telling you basically, sister, you can start it at 5 max. This will be your order. So when they say that start it at 5 max, they mean 5 microgram per kg per minute. Be very careful. Now the question comes to you that what do I do, because my infusion pump setting is ml per hour. That's where we have to start calculating. So first thing is that you must have in your hand is a weight. You must have the patient's weight, the dose that is required by the physician, and your available stock strength. Why I say available? Because in my pharmacy, they supply me at 200 mg per 100 bag. In some other pharmacy, it will be like 800 milligram per 500 ml bag or per 250 ml bag. So the available dose varies. So that's why you have to know your available dose in the pharmacy. Now we come to the drip calculation. Let's make it fast. Your order is very simple. It's patient ordered at IV dopamine at 10 max. Patient weight is 60 kgs and your dopamine bag reads 200 milligram per 100 ml. So my question to you is, set it at ml per hour or set it at your most preferable IV pump rate. So as I told you, what you have to know the weight of the patient. We know it already. It is 60. The dose, 10 microgram per kg per minute. And our available stock strength for me, for example, is 200 mg is coming in 100 ml bag. So first things first, weight based. So you must know that your dopamine is always weight based. So you must have a weight in hand. It's always dose based. It is always given ml per hour. So your formula comes as your 4 important components are your desired dose, your body weight, your time, and your available dose. Formula comes as desired dose into body weight into time. Time is 60. That is into minute in its minutes form into the available dose. Before that, what is very important is you have the available order as microgram. You have to convert it into milligram for you to continue with the available dose that is coming to you. So you have to convert milligram that is with you into microgram. So 1 mg as we know is 1000 milligram. So 200 mg will be 200,000 milligram. So in 100 ml bag, how much milligram are you having? 200,000. So per ml will be how much? So 100 ml is 200,000. So 1 ml is, you divide this whole thing by 100, which will give you 2000. So 2000 microgram. This is your available dose that is with you. So each ml contains 2000 microgram. Now you compute it in the formula that you have. Desired doses, as the doctor said, 10. Your body weight of the patient is 60, and the time that you will give it in 60, it's converted into minutes, and your available dose is 2000. So let's compute it. 10 into 60 into 60 by 2000. You have 3 zeros up, so 3 zeros down will go. 36 by 2, 18. So you have 18 ml per hour, right? Now you have something called a continuous. I think I will also explain to you one another thing. What if it comes to you as like 18 ml per hour? Now, how do I change it into drops per minute? What is my formula for drops per minute? Drops per minute is, that is GTT per minute. Am I correct? So I know ml per hour is how much? 18 ml per hour. So the formula is ml per hour into 60 by 60. For example, why I took this 60 is your drop factor. This is your drop factor divided by time. Okay, time is always in 60s. Okay, so if I do 18 into drop factor, that is 60, this may change. This may be you got a infusion set of 20 drop factor, you got an infusion set of 15 drop factor. This is variable. Okay, by 60 this will not change, so you have this cut. So this is 18 drops per minute. Now what are my nursing responsibilities? Number one is continuous ECG monitoring. Why? Because this is a vasoconstrictor, this is a beta adrenergic agonist. So what is its role? It increases your heart contractility, so your heart rate is increasing. You have to keep an eye if there are some tachyarrhythmias. Monitor vital signs, especially look out for your blood pressure. IV sites for signs of extravasation, because as I told you that it is a drug which has a potential effect of extravasation or tissue damage if it leaks. And monitor your hourly urine output whenever you are giving a dopamine. That's all. Thank you so much. This is a very easy calculation. Along with this, I will be giving you a practice question. So just keep doing it. Thank you so much. Bye bye. Take care. Please do like, subscribe, and comment for anything that you want. Bye bye.